Ba't parang namumula? Huh? Parang namamaga. Oh no. May pimple?
Signs of infection. Let's go! Hi guys, Doc Reggie here, your most approachable aesthetic surgeon na nagbibigay sa inyo ng kaalaman, katotohanan, at minsan katatawanan. Welcome to Doc Guides. In this channel, I give tips, advices on skincare, aesthetic procedures, at iba pang pampaganda, as well as health and prevention, and helpful topics just like this one. So if you're new here, subscribe na! At sana marami kayong matutunan. O diba, bagong tagline? Bagong lahat, super salamat sa inyo guys. We are on 8K subscribers na and growing ang community. Basta natututo kayo, happy ako. Don't worry, di pa ako nakaka-conduct ng giveaway dahil nga sa quarantine, pero meron yan. No stress ang giveaway. Pero conduct na lang natin pag open na yung clinic. Nakakabitin pag nanalo ka tapos di mo pa maklaim. Soon guys, so please pag-pray ninyo. For now, stay safe. Shoutout pala kay Jasper for so many things. He's another social media authority. Very nice yan. Okay, let's get to what we came here for. So how do you know may infection? First, we have to understand that there are many types of infection. Pwede respiratory, urinary, yung sa UTI, marami pa. Pero since this is a surgical procedure, we focus to what we call SSI or surgical site infection. So basically, this can be applied then on any kind of surgery. But since rhinoplasty is arguably one demanding facial surgical procedure, I'll focus toward dun more. There's what we call the cardinal signs or the classical signs of infection. The Latin terms rubor, calor, dolor, and tumor. Naks, may palatin-latin ka na dyan ha. Redness, warmth, pain, and swelling. Yan ang mga earliest signs na babantayan nyo sa ilong nyo or kung saan kayo may procedure. Look, like this. But wait, applicable yan if mga more than 3 weeks na. Kasi syempre, pag bagong gawa pa, syempre may swelling pa yan, may redness pa yan, may pain pa yan, and warm pa yung area. If after 3 weeks at naalis na yung sutures ng maayos, most likely, healed na dapat. May konting swelling na lang siguro. But kung yung swelling, imbis na lumiliit, mas lumalaki pa or bumubukol, or kung yung redness, hindi pa din nawawala, warm pa din yung area, or yung pain lalo lumalala, then you may have signs of infection. Factors that can cause this. 1. Poor ang pag-alaga or paglinis dito every change of dressing. Don't worry, tinuturo ko yan na mabuti after the surgery. Kaya makinig. Gusto nyo malaman? Next video. 2. Poor medication intake, especially antibiotics at anti-inflammatory. May schedule yan for a reason. Please follow your doctor's advice. 3. Poor health and diet. People with unbalanced system like may diabetes or not eating healthily, mahihirapan ang body to heal properly. Or if matagal na yung implant, to maintain its ability to fight infection. Best talaga ang fruits, fiber, vegetables with good exercise. 4. Pasok na ang bisyo, smoking. Kahit na ano sabihin nyo, smoking is bad for you. May vape ka daw. Shh! Nabenta ko na! Smoking has so many harsh chemicals and one action is it gives us poor circulation. At yung mga immune cells natin, hindi makafunction ng mabuti. So, okay, healing period pa yan or kahit years na ang implant nyo, tatamaan ka ng infection. Ito pa, even more prone to scarring. Kaya nga, kadalasan ng mga pre-procedure guides namin, stop smoking at least 1 month before the procedure or better, stop altogether. Sorry, peace, love you. Another bisyo, 5 na, alcoholic beverage. Pwede pa din naman, but in moderation. Alcohol, when present in the bloodstream, impairs the healing mechanisms of the body. At lalo pa kayo prone to bleeding. So, pwede pa rin siya ma-infect. Dagdag kaalaman from Doc Guide. Pansinin nyo, if may dried blood na dyan, not necessarily sa inyo o sa sugat, pwede sa niluluto nyo or nag-dry na yan, buhusan nyo ng alcohol. Lalabnaw ulit. Diba? Mind blown. If that's the first time you realized it, subscribe button. If you already knew, subscribe anyway. 6 na. Another cause, trauma. If mabungguyan ng bongga, nice term, bongga. It could cause a natural swelling and can become infected. Kaya protect it like your private parts. Mali yata yung analogy. For athletes, I'm sorry, pero wear face guards. Paano sa swimming, Doc? Kahit wag ka na mag-face guard, baka matalo ka pa, ako pasisihin mo. Peace, love you. 7. If you have a reaction to the implant, you're still prone to infection. Marami naman nakakalampas, pero they can have delayed reaction din, kahit more than a year. Pwede pa din, pero very unlikely na yon. Rare cases. 8. Allergic rhinitis and sinusitis. If may allergic rhinitis kayo, paggamot nyo na muna yan. Nagagamot yan, or at least nakokontrol. And especially sinusitis. Infection yan sa loob eh. So, pwede ka magka-infection up to your rhinoplasty or kung saan yung implant. Subscribe, subscribe, subscribe! 9 na. Eto, kasagutan sa mga common questions. Pimple. If the pimple develops very near to the implant, ingat. Do not prick or do anything. Treat nyo lang mildly with cleanser and inform your surgeon. And pwede kanyang resetahan ng mga pwede ilagay dyan. Besides, if maraming pimples, especially sa nose, patreat nyo muna yan. Even blackheads, bago kayo magpa-procedure. Oh, I hope you take this into heart and make this checklist whether you already had the procedure or if papagawa pa lang kayo. Other signs of being infected, pero late na itong mga to yung mga napabayaan. These are discoloration sa area, fever, may draining fluid sa sugat, non-healing sugat, amoy bulok kahit saan ka pumunta. Probably it's inside kasi. Or, wala kayo maamoy. Oh no! Then, something is wrong at progressed already. Knock on wood, wag naman sana. Question. So, Doc, what if the implant gets infected? What now? Ganito yan. Siyempre, best advice is to go back to your surgeon and ask for proper evaluation and further treatment. What usually happens is, you get a course of antibiotics, mga 7 days, or pwede i-extend to 14 days. Or, in special cases, diretso hospital management para sa IV line na dadaan ng meds. Same lang naman whether silicone, Gore-Tex, or cartilage, susubukan yan i-treat. Now, if unfortunately hindi nahabol ng antibiotic at nasa implant na ang infection, then sorry to say, removal of implant na. What? Huwag nyo na patagalin, baka mas lalo pa maging dangerous. Now, on other clinics, they do the replacement ng implant at the same time ng removal. Me, I don't do that. It has a higher chance kasi to get infected ulit. Eh syempre, ayaw ko kayo at risk. Protocol ko, removal, then after minimum 4 to 6 months, pag wala na swelling, then we can proceed sa revision. Ganun yun. So, pasensya na ha, just looking out for you. Kaya, best to ask many clinics and talk to other doctors. Baka naman mas specialist sila sa aspect na yun, di ba? Doctor shopping? Hoy! Hihi! Tinamaan siya! Peace, love you! Paano pag revision, Doc? Kahit walang infection, mag-aantay pa rin ba? Sa akin, yes. Remove muna, wait a few months, then lagay na ng new implant. Maybe sa ibang clinics, pwede ang same procedure replacement. Pero me, I don't do that. Now, there's such a thing called seroma, which is a collection of fluid under a surgical site. Don't worry, it's not an infection. pero there's a chance it could convert to infected fluid. Usually, it can resolve on its own, pero we treat it by draining the fluid bago pa mag-infect. Okay, natatakot ka na? Don't be. We surgeons do everything we can to prevent it. Pero syempre, big part of it is nasa sa inyo, sa pag-alaga ninyo, ganon. At may magagawa naman if ever. It happens unfortunately, minsan walang reason, but actually it's very rare. And natitreat naman mabuti. Lalo na may natural protective mechanisms din ang nose. The benefit of having the confidence boost versus the risk is always a healthy debate. Kaya sabi ko palagi, learn more, wag lang sa mga sabi-sabi nakikinig. Now, uulitin ko po. For now, I don't send or post pics of my patients, even the models. I didn't have the need. Naks. And honestly, I treat each case as VIP. Para sa akin, artista kayo lahat. Maybe in the future, if the image of the clinic develops, pero for now, I just show them during face-to-face consults. Okay, gets na? Great! Lagi ko rin to sinasabi. Ang best doctor is not really dahil sikat, not really dahil endorsed siya. Sa skills, yes, big factor yan. But the best one is someone who you can talk to freely from the start to finish, even after. Sobrang skilled nga ng doktor mo. Pero if may problem, nahihiya ka na kumausap. Kasi baka magalit, o masungit, o sobrang gwapo. Natutulala ka pagkausap mo. Joke lang. Basta happy lang kayo lahat. So yun guys, sana may natutunan kayo. Question for you, worried na kayo? O brave na lalo? Kasi mas alam nyo na. If you want to inquire about my rates, go to the FB page and look for the services tab. Chat kayo if you have any other questions. Links of the clinic pages are in the video description. Click nyo yung small triangle dyan para ma-reveal yung description. Rhinoplasty series, watch nyo muna. Baka nasagot ko na yung mga tanong nyo dito. And if you haven't subscribed, subscribe na. Pati bell icon, more videos to come kasi. Para una nyo malaman if may bago. Like and share ha! See you sa next one. Bye!